Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for last 25 years and I love it. This lecture is a part of my embryology lecture series titled as Fertilization Part 3. So students understand that the female produces a secondary oocyte by process of oogenesis. Male produces sperms by process of spermatogenesis. Both the secondary oocyte and the sperms travel to the ampular fallopian tube where they may unite by process of fertilization to form an embryo. Now all this is the process of fertilization and factors affecting fertilization. Today we are going to talk about what are the effects of fertilization and the applied aspects related to it. In my earlier lectures, I have discussed the transportation of gametes to ampular fallopian tube and then finally in the ampulla, how the sperms penetrate into secondary oocyte and finally how a zygote is formed. So that's lecture 2 and transportation is lecture 1. I suggest you watch those as well. So let's begin our discussion on effects of fertilization and applied anatomy of fertilization. That is lecture Fertilization Part 3. Right. So effects of fertilization. See, a sperm and a zygote and a secondary oocyte have united. What are the effects of this union? Let's take a look. If you recall, I told you that the secondary oocyte is arrested in this metaphase of second meiotic division. You can see how the chromosomes are attached to the meiotic spindle. That's the secondary oocyte, and that's the division arrested in metaphase of second meiotic division. Now what happens? When the sperm enters into the secondary oocyte is stimulated to complete its meiotic division and resultant development of definitive oocyte and second polar body. So, completion of second meiotic division occurs. So, when the gamete was haploid, the sperm was haploid, the secondary oocyte was haploid, but the new cell that is formed is diploid. So, restoration of diploid number happens because of this. Determination of the sex of the child. Absolutely. The parent, the male parent provides the sperm which may be carrying 22 plus X chromosomes or 22 plus Y chromosomes. Accordingly, the sex of the child is determined. So, that is why we say that it is the father who determines the sex of the child, not the mother. Again, there is immediate cleavage division and formation of two-cell stage. So, that also is the effect of fertilization. And remember, throughout the process, there is crossing over happening. So, and there's a thorough mixing of maternal and paternal chromosomes. This is how variation has been brought about in the human species. Okay, so let's revise quickly once. What are the effects of fertilization? Completion of second meiotic division, formation of a definitive oocyte and second polar body, restoration of diploid number, determination of sex of the child, cleavage division to form the two-cell stage, and variation in the human species. All these are effects of fertilization. What are the applied aspects we could discuss under fertilization? It's very easy. One is there an abnormality in the fertilization process? One. How can you prevent fertilization? It's not like you want fertilization every day, isn't it? So how can you prevent fertilization? What are the causes of infertility and how do you overcome this infertility? These are the 4 broad headings under which you can discuss applied aspects of fertilization. Let's begin by abnormalities. See, normally we say that oocyte undergoes Zona reaction and more sperms cannot enter into the secondary oocyte. Suppose before the Zona reaction, another sperm manages to enter in. Then you have a condition called dispermy. 1 female pronucleus, 2 male pronuclei. So the total content, chromosomal content in that cell is 24 multiplied by 3 haploid. Okay. So such cells, if formed, are naturally aborted. Some animals have something called parthenogenesis, an asexual reproduction. The oocyte itself divides to produce the progeny. This is not seen in humans. Another question arises that there is a secondary oocyte and right next to it there is a first polar body. Why do they not unite to form an embryo? If such things do happen, then again they are naturally aborted. Right. So let's talk about ways of preventing fertilization. I think I'm on very comfortable ground now because my audience already knows this, isn't it? All of you have been taught ways of preventing fertilization at a very young age now. Luckily, as the society changes, these things are openly discussed and it saves a lot of people a lot of grief, right? So, ways of preventing fertilization, there is something called vasectomy, where as you can see, the vas deferens has been cut and tied off. So, the sperm produced in the testes is unable to breach this gap. This is a way of preventing sperm transport and preventing fertilization. More about this can be found in the part 1 of fertilization lecture. You can go take a look at that. Again, here you are seeing something called tubectomy. Can you see how the fallopian tubes have been cut and tied off? Okay. The secondary oocyte reaches the fallopian tube, but the sperms that are released inside the vagina are unable to cross over this gap and reach into the ampulla fallopian tube. Again, this is a way of preventing transport of the gamete. Other methods of contraception include using condoms, diaphragm placed in the vagina. Now, these are again transport. These are again methods of preventing transport of gamete. But there are some methods which are hormonal. For example, you may be given a combination of estrogen, progesterone. These will prevent ovulation. They will cause anovulatory cycles to happen, preventing fertilization. This can be obtained in the form of a pill, a skin patch, a vaginal ring, and you can get an injection also. Again, today there is a discussion of a male pill. So that will result in stopping the sperm or reducing the sperm population to so low that it will result in infertility. Again, there is something called See, students, I'm taking this in very brief because I believe that all this has been taught to you in your school years. Okay. So there is something called IUD, intrauterine device. So the device is placed inside the female reproductive tract. Its very presence prevents implantation of the embryo. It also has releases, for example, in case of copper T, releases copper, which further prevents implantation of the embryo. You also have today what is called emergency contraceptive pill, which can be taken within 120 hours of the intercourse to prevent fertilization or implantation. Right. So these are all methods of preventing fertilization, which in our country is a very important question, which will be asked to you often in your exams. But 15 to 30% of couples today are faced with a major problem, infertility. They are not able to conceive. What can be done? What could be the causes? The causes, of course, can be divided into male causes and female causes. In the male, it's usually there are 4 points on which discussion or analysis can be done. Sperm count, sperm motility, sperm structure and viability. Here you're seeing that this is a normal sperm count and you can see the sperms are very scanty. Such scanty sperms really cannot bring about fertilization. Similarly, you can have abnormal structure. For example, here you're seeing large-headed, big-headed, small-headed sperms. Or you can have sperms with abnormal tail, abnormal body and so on. All this is morphologically abnormal sperm, will not bring about fertilization. So all this has to be studied. Sometimes the problem is with the delivery of sperm. So person may have a sexual problem, may not be able to perform the sexual act or whatever. So abnormality in delivery of sperm can also be a cause of infertility. Damage to the process of spermatogenesis itself. See, sometimes a person may be exposed to chemicals, heat, even heat prevents spermatogenesis. This is what is seen in truck drivers who drive for long periods of time and their testes are exposed to that much heat that they become infertile. Okay? Or even infections of the testes, for example, orchitis following parotid infection. It can result in infertility. Okay? And it's by the time the person finds out, it's too late to do anything about it. So these are all male causes of infertility. Female, of course, there are as many female causes. Primarily age. When we say that there is an age in which one must conceive, yes, age itself prevents fertilization. Sometimes people have ovulation disorders. They may have developmental anomalies of the uterus. Okay. Fallopian tube is often blocked. In our country, tuberculosis causes fallopian tubes to be blocked and result in infertility. Sometimes a person might have maybe cancer for which person undergoes radiotherapy, chemotherapy. This prevents fertilization, and there are many other causes. So, causes of infertility, one must ponder on the causes because then only you can solve the problem of infertility, which is almost an all-consuming thought for parents who are unable to conceive. So then what do you do for such parents? Okay. What you do for these couple is called as ART. Art? No, it's a different kind of art. Assisted reproductive technology. And a lot of procedures come under this. Okay. What does it mean? It's a process by which you are manipulating the oocytes, the sperms, the embryos in such a way that the couple finally receives a live, healthy baby. You can manipulate the oocytes, you can manipulate the sperms, you can manipulate the embryos. Okay. So all these are the procedures which come under ART, Assisted Reproductive Technology. Let's take a look at each of these in brief. So you're seeing here what is called in vitro fertilization. I'm sure you already know what it is. Here you're treating the mother with some hormones so as to stimulate ovulation. So you're now collecting the oocytes. So also you're collecting a sample of sperm from the parent. Okay. Now you're mixing these two, hoping for fertilization. When that happens, the embryos are incubated for a little bit of time till they multiply a little in size. They are now released inside the uterus, hoping that some of them, one or maybe two, implant in the uterus. And finally, the mother shows a positive pregnancy test. This is called in vitro fertilization. What is intracycloplasmic sperm transfer? You will hear this very often. It's ICSI. They call it ICSI. So what is this? See, a sperm is directly injected inside the oocyte. Okay. So this is seen when there are major fertility issues and you just pick up one sperm that is viable and you inject it inside. ICSI. Let's talk about gamete intrafallopian transfer. Read it. Gamete intrafallopian transfer. You are collecting the gametes, oocytes and sperms, and you're just releasing them into the fallopian tube, allowing fertilization to occur inside the mother's body. Okay. There's something called zygote intrafallopian transfer. Common sense. Zygote is being transferred into the fallopian tube, allowing for natural implantation in the mother. Frozen embryo transfer. See, you were doing in vitro fertilization, right? So when you were doing that, you found that there were 4-5 embryos developed. You're not going to release all 5 and all 5 of them might develop into babies, right? So what you do is you save some of those embryos and freeze them. In the next cycle or the cycle after that, if the mother has not conceived, then you can use these frozen embryos for trying again for implantation. Ovulation induction. What is that? You're giving some injectable into the mother, causing the ovary to release more number of oocytes than normal. More the oocytes, more the chances of her conceiving. However, this is a two-edged sword because there are limited number of oocytes in the mother. So if you keep on stimulating, you might just run out of oocytes before the mother manages to conceive. So be very careful when you are thinking of using these ovulation stimulants. Right. Pre-implantation genetic testing. What happens is the embryo might even be tested before the embryo is implanted to ensure that the embryo does not have any major chromosomal abnormalities. This is also possible today. Finally, if there are parents who are incapable of carrying the baby, not physically carrying the baby to term, what do? Do they not have a right to have their own baby? Yes. In such a condition, you have what is called as surrogacy. Of course, there are a lot of laws involved in all of these things that I've been discussing. Remember, it is not, everything is not without legalities involved. There are legalities involved. Okay? But a surrogacy is a process by which a third person acts as a carrier to carry the baby to term, and then once delivered is handed over to the parents. This is surrogacy. So students, in the last 15 minutes, we discussed effects of fertilization and we discussed applied aspects of fertilization. We discussed how there can be abnormalities in fertilization, how to prevent fertilization, what is infertility, what are the causes of infertility, and today, what are the treatments available to overcome the infertility problem. Okay, so I suggest that you also watch lecture 1, which is fertilization lecture 1, where we are talking about transportation of male and female gametes to the ampular fallopian tube, and fertilization lecture 2, when in the ampular fallopian tube, the two have fused together to complete the process of fertilization. And then lecture 3 was today's lecture, where we discussed the applied aspect and effects of fertilization. Students, if you like this lecture, do like and subscribe to my channel. Do share your comments about this lecture. It will help me to understand what more I can do to help you in the process of your medical education. Okay, so I love taking this lecture. I hope you enjoyed attending it too. See you across the screen in some other video.